We're at the Hilltop Pet Clinic, and I'm with Dr. Brandon Beebout. How do you know when your pet needs to see the doctor? So we're talking emergency medicine, so how do we know?
So let's start with species first.
Okay.
So let's start with cats. We see, cat stress organ is the lungs. And so anything with respiratory distress, cat or dogs, where we see an increased effort in that respiratory and we see an increased rate. So fast and heavy. That is something that is definitely worth a call. Definitely a better safe than sorry type of thing. Another big one in a cat that does not get talked near enough about, young male cats. Urinary obstruction. And so we know that there's a phenomenon, it's a neurohormonal thing that's called FLUTD, F-L-U-T-D, feline lower urinary tract disease. And what happens is, lots of times it's due to stress, it can be for some other reasons, stones, urinary tract infections, which are actually pretty rare in our young males. And what happens is there's a gap in that bladder, and proteinaceous exudate, red blood cells, inflammatory mediators kind of leak into there, and male cats have very small urethras, and it goes down there and it plugs. And so that is a true emergency. And so the typical scenario there is I come home from work and my cat's in and out of the litter box yowling. Lots of times there's vocalization. There might even be some vomit and decreased appetite, lots of lethargy. And you go over there and you look in that litter box and there's no urine production. That is not an 8 a.m. call, that is a 5 to 5:30 call. We would much rather get your kitty in because we urinate our toxins out. And so they build up, and specifically potassium. And the higher the potassium, the slower the heart rate. And so that's why we lose these kitties actually. And so that is a main one in our cats that we see. I see a little bit more frequently in the previous places I've been because it's, again, due to stress, bigger cities. We got a lot of happy cats here. I don't see it all that often, but it is definitely something that we want to pay attention to. And that's something that a lot of people don't know about. And so that's why we're doing this today. Okay, so let's move over to dogs. And so really there, we see a lot of, shaking their head, a little dry, non-productive hacking cough. I'm limping. Urgent, sure. Something that we might want to see. It's not something that we have to rush in on. Obviously, if there's known trauma and we've broken a leg, yeah, we want to see you. If it's like, oh, the limp started tonight, we don't want you to worry that much. Hey, we're going to take it easy tonight. We're going to call the vet first thing in the morning. We're going to get you in. But again, on our dog side, one of the things that we'll see, a common emergency that I see, the stomach flipping, called GDV, gastric dilatation and volvulus. It's the Marley and Me little movie, and so they'll right after a meal they'll go out and run and play and they'll flip that stomach. That's an emergency. That's something that cannot wait. Collapse, and so we'll see that for a couple different reasons. Older large breed dogs will sometimes see little friends or tumors on the spleen, and they like to rupture, and so you might look at your pet's gums and they're pale. That would be a reason to call the vet. They might be weak / collapsing. They also might have an increased respiratory rate and effort there too. Bee stings is another one that we see pretty frequently, especially in obviously our warmer months, and that can look a number of ways. The big puffy face, that can swell all the way into the respiratory tract, and so if it gets bad enough where you have a pug or a bulldog, you might call before you maybe have a Great Dane with a puffy face. But there's categories, and so as that goes on, a mild insect hypersensitivity can lead into anaphylaxis, and so that is something that looks like a very pale / muddy gums, collapse, those type of things. That's where you need that epi shot, that epinephrine shot, and so those are the main ones that we typically see in our clinic.
So just give a call if you think any of those are all happen.
Yep, and again, if you're concerned, we're concerned. There may be something where we share our EBS service, and so how that works is one of the 4 clinics in town takes the call, and so we share. We're Wednesdays and every 4th weekend right now, and we'll talk you through it and kind of decide together: is that a true emergency? Do we need to get you in?
Okay, thank you, Doc. Appreciate your time today.
Of course.
All right, stay with us. We'll bring you more Pet Doc next Monday right here from the Hilltop Pet Clinic.